Hello, my name is Max Knight. I'm a second year student in the Indiana State University Doctorate of Athletic Training program, and today's video will be over Maitland mobilization for the subtalar joint. Now, first considering the subtalar joint and its function, it helps the foot pronate and act as a possible adapter when weight bearing, and even through the gait cycle on irregular terrain or surfaces. It also allows the foot to supinate into a more to an increased stability in the sagittal plane during gait propulsion. So during that toe off, when we're kind of pushing forward, it just allows the foot to stay in a more stable position in that sagittal plane. Some indications for this is if there are any deficits in ankle inversion, eversion, and possibly even pain, discomfort, and also if there are any deficits with plantar flexion or dorsiflexion in the ankle. Following this will be an example of Maitland mobilization for the subtalar joint and some commentary to go on with that. To help improve ankle inversion at the subtalar joint, the patient will be side-lying with the medial aspect of their ankle facing towards the ceiling. The clinician will then stabilize the distal end of the tibia and fibula by grasping and pressing just a little bit into the table. The patient will have their ankle slightly hanging off the table. The clinician will have their hand grasped around the calcaneus and will provide 1 to 2 sets of 5 to 8 repetitions of a lateral glide towards the floor on the patient's subtalar joint. To help improve ankle eversion, the patient will be side-lying with their ankle slightly off the table, and they'll have a lateral aspect of their ankle facing up towards the ceiling. The clinician will grasp the tibia and fibula, or the malleoli, to stabilize the ankle joint, and will grasp the calcaneus and provide medial glides towards the floor for 1 to 2 sets of 5 to 8 repetitions. A couple last things to consider is to make sure that the malleoli of the patient's ankle are on the table to better stabilize and provide better glide at the subtalar joint.